I'd like to offer a few brief remarks on sepsis risks and determinants for migrants and refugees, some of whom are in high-risk situations for sepsis, whether the large majority of migrants working in urban settings worldwide, or in rural agricultural work, at construction or mining sites, or in refugee and IDP camps. This addresses the bigger picture of international migration and mobility, indeed a notable concern for every health system in the world. A fundamental point I want to stress is that reducing sepsis mortality by 2030 and achieving a global health success story requires specific attention to appropriate migrant and gender-responsive measures, inclusive of all migrants, refugees, and other foreigners. UN statistics show that the global estimate of migrant stock is around 304 million people at the end of 2024, about 3.5% of the world population. The UN data counts migrants as foreign-born persons resident in a country other than birth or citizenship for a year or more. This includes most of the 30 million refugees, asylum seekers, or persons of concern to the UN High Commissioner for Refugees office, but doesn't include IDPs, internally displaced persons. 80 to 90% of all migrants reside in urban areas, and the majority of migrants are in industrialized countries of the West. Around 18% or more of populations of Australia, Canada, Germany, Switzerland, the USA, and other Western countries. Migrant populations have generally higher education levels, in fact, than native cohorts. Sepsis risk factors are compounded for immigrants and migrants. Many face below living wages, greater risk of occupational injury, less access to social protection, notably health insurance or similar coverage, higher barriers to access medical care, language barriers, all adding up to generalized restrictions on realization of the right to the highest attainable level of physical and mental health and health-related rights. Migrants' realization of health rights is crucial to prevention of sepsis. That realization is also constrained by increasing prevalence of anti-foreigner, anti-migrant, anti-refugee discourse and public policy, as well as notable incidents of anti-foreigner, in-your-face hostility and outright violence. Migrant workers are concentrated in 3D work, that's dirty, degrading, and dangerous work, many in sectors with higher risk of accidents, injury, and illnesses, meaning exposure to infectious agents and lack of personal protective equipment, particularly in agriculture, construction, health sector services, cleaning and maintenance, and sanitation, among others. A 2023 report by the International Labour Organization estimated that annually 3 million workers lose their lives, while 395 million workers worldwide sustain non-fatal work injuries. The sepsis risks entailed are manifestly large and broad, enumerated in a paper circulated at the meeting. Foreign worker incidence of workplace injury and death is double that for native-born workers. There is considerable medical research and other literature addressing sepsis and refugees, migrants, and displaced persons. However, much of the extant literature conveys only partial or skewed understandings of migrants and migration, and consequently often misses what needs to be said and what needs to be done in policy terms to address and reduce the sepsis risks for migrant and refugee populations. So in response, we suggest a sepsis agenda addressing migrants and refugees, and its main points would include targeted health education for all persons with outreach to immigrant groups and communities, providing sepsis knowledge regarding migrants, refugees, and foreigners in all health-related training and in services, providing information and interventions in languages all people, all migrants can understand, ensuring there's proximity of health care services, particularly primary health services, to where people live and where migrants in particular live, and making a priority of occupational safety and health risk prevention, including targeted labor inspection. In broad terms, this agenda intersects with the push for universal health coverage and care, with public health policy that has specific approaches for all groups and populations, including specifically migrants and refugees, generalization of WASH approaches in cities and rural areas, WASH meaning water, sanitation, health, and hygiene, and implementation of occupational safety and health standards applicable to all workers. The challenge for the Sepsis Alliance and WHO, as well as for health institutions globally, is to give targeted attention to research and policy on migrant-responsive components for preventing sepsis. This agenda, of course, coincides with the 5 strategic pillars of the 2030 Global Agenda for Sepsis and should be integrated into implementation of that agenda. Thank you.